During the COVID-19 pandemic, telehealth became one of the hot topics, affording connection to providers through the web or the phone. Yet, we know that new technologies don't spread equitably. So, researchers from the Dana-Farber Cancer Institute in Boston interviewed a group of healthcare providers and community representatives about telehealth for cancer patients in Lawrence, Massachusetts. This is a city of about 88,000 people, about 83% of whom identify as Hispanic or Latino. In this brief video, we'll share the highlights of what we learned and opportunities to support success. Before we get going, we want to give you a sense of who conducted the work. The researchers were part of the Viswanath Lab at the Dana-Farber Cancer Institute. Several members of this team are part of the Dana-Farber Harvard Cancer Center U54 Partnership Outreach Corps. Team members have been collaborating with the City of Lawrence Mayor's Health Task Force and other community partners in Lawrence to conduct public health research and programming for 17 years. As you can imagine, this is a source of real pride. Until the COVID-19 pandemic, telehealth care was not an option for cancer patients in Lawrence. By telehealth, we mean healthcare services provided via video or phone call with providers and patients in different physical locations. Although many healthcare appointments have transitioned to a virtual format, we know that technology often reaches communities inequitably for reasons such as discrimination, access to quality internet connection and devices, or technological literacy that will allow folks to benefit fully from virtual appointments. This study aimed to understand how healthcare providers in Lawrence felt about using telehealth with their cancer patients. It also aimed to explore the future of telehealth for cancer care in Lawrence. We conducted interviews with 10 people to understand their perspectives. The group included 5 oncologists, or doctors who specialize in cancer treatment, 1 patient navigator, 1 registered nurse, and 3 community representatives. The team found that there were 4 core drivers of success, or supports needed. First, the patient has to be willing to use telehealth, and this varied a great deal. As one patient navigator put it, some patients who were not used to that technology struggled with it, and then some patients, it actually worked out better for them because it saved them from having to come into the office. An oncologist also noted that over time, patients' comfort with telehealth and willingness increased, leading to successful telehealth visits, especially for quick visits or receiving results of lab work. Second, the patient must have a device they can use for telehealth and access to an internet connection. The registered nurse noted, they all have this limitation. Like, I don't have a computer. I don't have a smartphone. Those people, we could not reach through in the COVID time. And one of the community representatives explained, lack of access may relate to needing to allow others to use devices, like a child attending school online. Third, the patient must have the technology-based skills to sign on and navigate the visit, as well as realistic expectations of how the visit will be conducted. A community representative noted, with the older folks, they need help using it. They're more comfortable if they have someone helping them to navigate it. You'll find not every older adult is completely comfortable navigating processes on technology. The patient navigator noted, I think because they are sitting at home and doing the visit, they forget that sometimes still, even though they're not there at the office, the doctor or the nurse practitioner does still fall behind or have an emergency that makes them fall behind. Where, when they're in the office, they know that the doctor's running behind. Fourth, there were challenges for patients to connect and make it all the way through the visit. As one oncologist observed, their technology sometimes, they were not able to connect, and we have to reschedule them. They have to resend a link. Things like that happened a few times. The participants brought up several benefits to telehealth visits for cancer patients. First, when the visit is going to be quick, such as going over lab results after an in-person visit, telehealth is more efficient. Second, telehealth provides the opportunity for patients and their providers to speak with specialists who are not working in the same clinic. Additionally, given that many patients have barriers to receiving care, such as transportation issues or being immunocompromised, telehealth provides a helpful alternative. The participants also brought up some disadvantages to using telehealth. For example, they are not able to examine the patient over telehealth. This can lead to patients delaying their cancer screenings and therefore not getting diagnosis in a timely way. It can also be difficult to collaborate with colleagues if they are in different clinics and cannot simply stop by each other's offices. So, where do we go from here? There are clearly some visits, like getting lab results or meeting with a group of dispersed providers, that could be good candidates for visits. Participants recommended that providers educate patients about what to expect during telehealth visits. For example, that they may need to wait in the virtual waiting room because providers might be running late, and how to use the patient portal. They suggested that the city needs to promote awareness of telehealth offerings in the community, such as the telehealth booth in the Lawrence Public Library, and add more offerings in accessible locations around the city. Related, participants suggested that it would also be helpful to add more telehealth stations in clinics to make visits easier for patients who don't have reliable internet connections and or who need to meet with offsite specialists. Finally, it was suggested in the interviews that cancer patients have other health needs that could be addressed using telehealth, such as mental health and general wellness checks. On the right is a picture of the telehealth kiosk in the Lawrence Public Library. This opportunity is available, and we need to rally supports to ensure folks in Lawrence and similar communities can take full advantage. Thanks for your time. We invite you to visit the Planet Mass Connect website for more information on community based research and evidence based programming. You can use this URL or scan the QR code with your smartphone's camera to access the site.